Hi, it's Mark Finch. Thanks for taking the time to follow the link and find out some more about the upcoming course that I'm presenting, the fascia, its structure and function. This one's on the pelvic girdle. The nature and behaviour of the fascial tissue is becoming more widely understood through a lot of work by many scientists and clinicians around the world. What you're looking at here is a portion of the iliotibial tract. You can see just how fibrous it is and how fabric-like. Much of this scientific information is being presented at the Fascia Research Congress. The last one was 2 years ago in Harvard, and the next one is coming up this year in October of 2009. So the challenge for me as a teacher is to see how I can take some of this very valuable scientific information and present it in a way that's useful for clinicians to understand how the fascial system fits into the picture of the client who's walking into your office. So when our clients or our patients walk into our office, usually it's motivated by either pain, so something is hurting them, or some performance issue, so they're not able to perform a skill either as well as they would like or sometimes at all. And these presentations are always comprised of factors from the skeletal system, the muscular system, and the movement system. So by the movement system, I mean the movement strategies that the person employs. Sometimes there's faulty movement patterns or even pain-provoking movement strategies that the person's not aware of. These three components have been well documented in many other places, but the one that we're interested in for this weekend is the contribution of the fascial system to the clinical picture. So that's the one that we'll be most interested in. It's also helpful to understand that all of these systems are operating in the context of the brain and the nervous system. And like I said, what we'll be focusing on for the weekend is how is the fascial system contributing to the whole clinical picture. So here's a little outline of what we'll do. First of all, we're interested in exploring the architecture of the fascial structures around the pelvis. And you can see from the slice that I took from the Visible Human Project website that these arrows that are pointing to these white structures in this slice, the white structures are not bones. None of these structures are bones. So you can see that these very dense fibrous structures through the back of the body that reach all the way up into the pelvis are fascial septums or fascial interfaces. And you can start to get an idea of how these might impact the biomechanics and the function of the pelvis. Here are some more slices. You can see that these fascial septums reach all the way up into the pelvis from the thigh. Here's a view of the thigh itself, and you can see that these fascial septums reach all the way through the leg, in between the muscles. And here it's especially interesting to notice that these septums all converge on the back of the linea aspera. So the potential for dysfunction in any of these septums could have an implication of rotation in the femur. And that's very useful to understand when you're treating the pelvic girdle. Second thing we'll do is understand how postural patterns comprise function. So we'll be looking at the position of the pelvis and how its alignment might impair function or create pain. Then we'll learn some simple tests to identify these imbalances, as well as basic orthopedic tests. We'll also be learning some tissue palpation tests. Here's a clip of me doing a tissue palpation test on the lower leg of this client in my office. And if you watch my thumbs in this test, you will see what happens when the leg is loaded and one leg standing. Here you can see the thumbs internally rotate, and then this is after treatment. They're much more neutral. So here it is again, the rotation towards the inside, and after treatment, much more neutral. So it's useful to understand that assessing the tissue, or the fascial tissue, is also a component in assessing how load is transferred through the pelvis, in one-legged standing especially. Obviously we'll learn some techniques to see if we can treat these compensations. And let me just give you a little before and after video of how some of these techniques can work. So here's the before video, asking the client to bend forward, and you can see there's very little movement in the pelvic girdle. It's mostly happening in the lumbar spine, and this is where she feels the pain across here. Very little in the pelvic girdle, mostly in the lumbar spine. The treatment for Kate involved treating the thigh and the septums in the leg, as I mentioned before on the top left here, and also treating some fascial septums in the pelvic girdle. This is the after, so watch carefully. There's much more movement in the pelvic girdle when she does the forward bend, especially at the initiation of the forward bend. There it is there, more movement in the pelvis. And what she's telling you here with her hands is she now feels the strain in the back of her legs rather than in the spine as she was feeling it before. So this is a much more optimal outcome for a forward bend, to feel the strain in the back of the legs rather than in the lumbar spine. That outcome was produced by freeing up the fascial septums in the thigh to allow the pelvis to move, and then giving her some small movement cues in order to allow her to take up the new slack that she had just found in the fascial system. And lastly, we'll talk about how a fascial approach can integrate into the clinical picture and how it's useful in seeing your clients as a whole person rather than just a collection of symptoms. So as I said before, any dysfunction or to do with pain or performance coming into your office, the person who has a dysfunction to do with pain or performance coming into your office has components from various different systems, and this weekend is about understanding the component from the fascial system, but also seeing that in context of all of these systems. So, to review, we'll look at the architecture of the fascial structures, we'll understand how they relate to the postural patterns, we'll learn some tests to identify the imbalances, and then we'll learn some techniques to treat the compensations, and finally talk about how that approach can integrate into the work that you're already doing. So I hope this little video has given you some more information and a bit of a flavour of what we might be doing over the weekend, and I'm looking forward to seeing you on the course. Thanks for your time.